talking about mental health awareness. Before we begin, if you could just take a minute to take our pre-test and scan the QR code. So for the topics that we're going to be discussing today, we are starting off with mental health and describing what mental health is, talking about the stigmas surrounding mental health, and then various ways of getting help for mental health, and then finally statistics regarding mental health.
What is mental health awareness? Mental health awareness is the ongoing effort to reduce the stigma around mental illness and mental health conditions by sharing our personal experiences.
Why we chose it. So, mental health is often overlooked and stigmatized, yet it can be a serious problem. This information will be extremely helpful as future health professionals when dealing with a patient who has some form of a mental illness.
Mental health. Some concepts of mental health, the first one being mental health is a combination of psychological, social, and emotional well-being. And the second one, mental health affects the way that we feel and act as well as the way we think and handle stress.
What causes mental illness? Some causes of mental illness include genetics. Certain genes may increase your risk of developing a mental illness and your life situation may trigger it. Prenatal drug exposure. Exposure to harmful substances such as drugs and toxins while in the womb can lead to some forms of mental illness. And unhealthy habits. Participating in unhealthy habits like drug and alcohol use can also lead to the development of a mental illness.
Mental health stigmas. What are stigmas? Stigma is when someone views you in a negative way. They view you in a negative way because you have a distinguishing characteristic or personal trait that's thought to be or actually a disadvantage. Unfortunately, negative attitudes and beliefs towards people who have a mental health condition is common.
Common stigmas include blame. Those with mental health issues are to blame for the way that they are. Danger. People with mental illness are dangerous. Discrimination. People with mental illness are different than us and shouldn't be offered a place to live. And shame. Why am I like this? I'm not worthy of anything.
Mental health. Getting help. It can be difficult to get help while dealing with mental health due to the stigmas, but there are also copious amounts of resources to improve mental health.
Examples of mental health help include therapy. Therapy is the most common form of treatment and it includes one-on-one time with a trained mental health professional. Medication. Medication will not immediately cure mental illness, but it can help reduce symptoms when paired with therapy. Support groups. If you don't feel comfortable talking to a trained professional, there are many support groups where those suffering with mental illness share their experiences with other cases. And hospitalization. In some cases, conditions may worsen to the point where it would be best to explore hospitalization so the patient can be observed and kept safe.
Take care of your mental health. 1. Unplug. Taking a break from the internet can help you clear your mind. Number 2, call friends. Reaching out to a friend can help you relieve some feelings that you are holding you down. See a doctor. Seeking professional help can make a world of a difference. And 4, staying active. Regular exercise may improve depression or anxiety symptoms enough to make a big difference.
Topic 4, mental health statistics. 57,800,000 U.S. adults live with a mental illness, which is more than 1 in 5 adults in 2021.
Suicide rates. 700,000 people die by suicide every year, which is 1 person every 40 seconds. Mental health is a leading cause of suicide rates.
And finally, if you could take a moment to take our post-test. And lastly, here are some of our resources, and thank you.
Thank you.